And I never thought I would have to do that, but I do. And I put on a brave face. What tasks do sonographers perform besides just performing ultrasounds, besides scanning? The last one might surprise you. The first one is transport or transferring patients. So if you work in a hospital, sometimes the transport, I know sometimes they're understaffed, but you can be waiting for hours. I mean hours for patients. And sometimes they'll see the job and they'll click off of it. So you'll be waiting for this patient and they won't ever come. So sometimes when I was working in a hospital, I had to go to the patient's room and bring them down, or take them from the ER and bring them up to our department. This is a lot of what a lot of sonographers have to do in this field. And also, sometimes if you have, for example, an outpatient and they're in a wheelchair, you will have to help them to transfer onto a stretcher. So learning the best techniques on how to transfer a patient is something that is important for sonographers to know. Another thing we have to do before we perform an exam on a patient is look up their previous exams. If we're going to be doing the same type of exam they've already had, we definitely want to compare it to the previous exams, because the sonographer might have seen something that we have to follow up on. We have to take a new measurement of. Or this patient might have had a CT. So if you guys are familiar with the registry exams that sonographers have to take, now as part of the abdominal sonography registry, it's in the rubric that you have to be able to look at CTs and tell what's going on. So that's definitely one thing that we have to do. Sometimes I'll look at a CT, scroll through the images, and see, okay, they have going on with this kidney or the liver. This is kind of where I need to be looking while I'm performing the exam to be able to find that same pathology. Another thing that we do is we check labs. For example, if you're performing a first trimester OB patient, you need to check those labs. The ER should have ordered them, even though sometimes they don't. Sometimes you have to ask the department to, did you order the labs? Because you need the quantitative HCG, the hormone levels, to compare to your ultrasound. That's very important to be able to see if the pregnancy is progressing as it should be. Or other labs, such as liver labs, elevated liver function tests, pancreatic enzyme. We have to learn those as a sonographer and be able to utilize them when we are scanning. Next, we have to verify orders. This is not always the favorite thing that sonographers have to do. One thing about providers, sometimes they are very knowledgeable and they know exactly how to put in orders. They know exactly what to specify as far as the reason for exam. Sometimes they just do everything correctly. Sometimes they do not. Sometimes they might order, for example, the wrong laterality, or the reason for the exam might not match up with the order that they put in. So you have to call the physician or message them and clarify. I received this order with this reason for the exam. This does not match. You have to say it in a more tactful way. Did you mean to order this? Sometimes they will give you an attitude. Sometimes they're like, oh, okay. Yeah, let's do that. So, or sometimes they'll say, let's do both. Like, sir, ma'am, that is not the appropriate exam for the patient's symptoms. But we follow the doctor's orders as much as we can. And going along with those previous points, chart prep. This is something I do in my facility now. And it's pretty much doing those same things, but we make notes in the patient's chart. Or I've seen in another facility, sonographer there, she printed out a schedule and did the same thing. Expounded on why we were performing that exam, and she would be able to reference that whenever the patient got there to keep in mind while she was performing the exam. So we did the same thing, check the previous exams. We type that into the patient's chart so that when the patient gets there a few days later, then we know, okay, this was their previous exam, this is why they're here, this is why we're performing this exam. Another thing is that we have to communicate with nurses a lot, especially if you're working in a hospital facility. Check and see if the patient is NPO, if they're able to come down to the department, have they had their medicine that they were supposed to get. Also, if you are working in an outpatient facility or like a physician clinic, like I do, we communicate with the MAs. hey, I'm about to get this person first. If you want to do your intake after me, then that'll be fine. Just make sure that everybody is in a closed loop of communication. Everybody is aware of what is going on with each patient. Next, we have to clean our rooms. We have to refill gel bottles. We have to stock our linen. We have to wipe down the machine, wipe down the stretcher in between each patient. Next, we have to write up our exams. So this looks different at different facilities. I'm going to insert a clip here of what that might look like. Some facilities, they write down the pathology or the preliminary results of the exam on a worksheet. They scan it in, and then it uploads to the patient's chart. Other facilities like mine, we do electronic, for the most part, electronic reporting. So we have to click on the quality of exam. A good quality exam, was it adequate? Was it a limited exam? What type of views we use, what type of or modes of ultrasound. Do we use color Doppler? Do we use spectral Doppler? Do we use pulse wave, PVR exams? So we do all of that, and we have to click on different buttons for each piece of anatomy to explain if each thing was normal or abnormal and how it was abnormal. Is there a stenosis? Is there a mass? Is there a cyst? We have to put all of that information in. Velocity measurements, diameter measurements. We include all of those things in our reports and send those off for the reading physician to read. So this could be a radiologist or a vascular surgeon, for example. In the interim, sometimes we have to deliver preliminary reports. So this is often when we're in clinic, like where I am. We discuss what we see as the sonographers with the doctor who is working in clinic that day. We tell them, okay, this is what's going on with the patient. This was normal, this was abnormal, and this is how it's abnormal. Or if you work in the hospital, usually you would deliver preliminary reports to the ER providers. So that would be the nurse practitioners and doctors. But that depends on also what department you work in as well. In general sonography, I typically didn't do that. In vascular sonography, that was definitely a huge part of the job, especially for doing venous duplex exams, giving them results whether the patient had a deep venous thrombosis or not. Another thing that we do that is in our written out scope of practice for sonographers is advocate for patients. So kind of similar to what I said about clarifying exams, we have to make sure that the area of the patient's concern or wherever they're having pain is being advocated for, that the doctor understands exactly what's going on with the patient and that we are performing the correct exam, because not all of the doctors really pay attention to what is going on with the patient. For example, in one place I worked at, a doctor ordered a venous exam, which would check for blood clots in the veins, deep venous thrombosis, and that would be a lack of blood flow returning to the heart. This provider failed to get the patient to take off their pants, take off their socks, or their shoes. So he did not realize that the man's foot was rotting off. This would not coincide with the DVT study. This patient needed an arterial study because the blood flow going from the heart to his feet was lacking. So we're sometimes the first people who are actually really paying attention to the patient and know, okay, these symptoms align with this. Sometimes you have to really stand up for your patients. For example, like I mentioned, the first trimester exams. One time I was performing a first trimester exam on a patient and I could not find the fetus. And the HCG level of the patient was high, very high. I got on the phone and at that point I was more nervous. I didn't realize that we could advocate for our patients. I was kind of like shy about telling the provider. I got on the phone and I told her, like, I can't find the fetus. And I knew that was urgent. I knew that was an issue. And she just kept on saying, okay, we'll just get her to come back We'll just get her to follow up with OB. We'll just get her to follow up with OB. Ma'am, this is very serious when it comes to ultrasound, because when you cannot find a fetus and the HCG levels, the hormone levels are very high, that highly indicates that the patient has an ectopic pregnancy, which can be fatal. So I told that nurse practitioner like 5 times, but the HCG levels though, she was not getting it. She was not going through her head. Thankfully, eventually, the radiologist did call her and tell her, like, no, this patient needs to go with surgery. So we must advocate for our patients. Another thing that you might not realize that sonographers do is assist with procedures. So biopsies, paracentesis, where a patient has an accumulation of fluid in their abdomen, and sometimes their belly will be out to here with just fluid, ascites fluid. We will assist providers with draining that fluid off. Also build up a fluid around the lungs. Thoracentesis, we will assist with that. Breast biopsies, thyroid biopsies, those types of biopsies, we assist with those. We will sometimes hold the probe, set up the room, set up the procedure trays, make sure everything is sterile. All those things a sonographer can assist with. The last thing that sonographers do, some sonographers might do, especially echocardiographers, they will inject contrast for contrast enhanced ultrasounds. So that they inject those into an IV that was placed into the patient. So thankfully I have not had to do that. I don't think I want to do that. Yeah, that is something that some sonographers do. They inject contrast to better demonstrate potential pathology. And last but not least, another thing that sonographers do is some dirty work. Yeah, some dirty work. So this could be cleaning up bodily fluids. I have done that, especially in the hospital. Yeah, so my previous coworkers, she had her personal policy, which I understand, and I kind of adopted as well, is that if a patient defecates while they're in your department, then we should be the ones to clean it up. So that makes sense to me. So yeah, I've had to clean up poop and also blood more than I would like in some kind of scary situations. And also sonographers are CPR certified. So sometimes you might have to hop on a patient and start doing compressions. One of my previous coworkers, he had to do that. It wasn't during my shift, so I didn't see all the action, but that's something that sonographers have to do sometimes. Another thing we might have to do is call for a rapid response. If a patient is in distress, they're wheezing, or just something is going on with the patient that, for example, I had a patient who passed out one time. I had to go get help. So it's very scary, but this is something that sonographers do. Also, I currently work with a lot of patients with wounds. I never thought I would have to do that, but I do, and I put on a brave face. Yeah. Another thing, like I mentioned, we help with procedures. So when we do those paracenteses or thoracentesis, if it's diagnostic, we have to transport sometimes those fluids to the lab. And also, even if it's therapeutic, then we have to dispose properly of those fluids or put them in the right location. But that depends on what type of sonographer you are. Sometimes you might not have to deal with procedures. It just depends on the facility where you work. So if you are an inspiring sonographer or you're just doing research on this field, which of these things were you most surprised by? Comment that down below and I'll see you in the next video.